our group in our practice, we've noticed an increased number in patients that are coming to the office with colon cancer at younger ages before they even have their first colonoscopy screening. And we thought it'd be interesting to look on a national scale and see if we can find any hard evidence that indeed the rate of colon cancer is increasing in these younger populations. So we looked at the National Cancer Database, and the National Cancer Database takes approximately 70% of all of the cancer diagnosed in the U.S. And it puts together organized data that can be used for statistical analysis, so that hopefully we can find some larger national trends like this one. So our primary results were that we noticed that the proportion of young-onset colorectal cancers, meaning less than 50 years old, had increased every year throughout the 10 years that we looked at, from 2004 to 2013. What I think is important to note is that this is a proportion of cases out of the overall number of colorectal cancer cases diagnosed, and doesn't take into account population changes over time. And so I think further study needs to be performed in order to really get hard incidence numbers. I wouldn't say these findings are surprising at all. Young patients typically do better postoperatively. They do well after surgery. They bounce back quicker. But while we were looking at this population, we thought it would just be interesting to note what else is different in this population, but I wouldn't say any of them are particularly surprising. It seems that there is a trend towards increased colorectal cancer diagnosis in the young onset population, people less than 50. And I think it's important that when a clinician sees a patient with a change in bowel habits or rectal bleeding or any other concerning findings on exam, that even if they're less than 50, I think the threshold to perform colonoscopy should be a little bit lower, so that we don't miss these cases of potentially treatable colorectal cancer.